Hello, I'm Dr. Beech. Today I wanted to continue on this subject of posture and connection to the feet and how that relates to problems in the neck and the back, more chronic pain, we say. So first I want to show a video which I showed in another tape of the actual structure of the foot and how that structure can go out of alignment. So first let's take a look at that. So we saw there how that bone at the top of the arch, called the navicular bone, can come out of place because the ligaments that are holding that bone in place become elongated. And the thing about that is that there's no exercise to correct that because ligaments don't have any elastic fibers, they don't have any contractile fibers. So when a ligament elongates, it becomes too long. It's like an overstretched rubber band. It doesn't go back. So nothing can correct that. There's nothing we can do exercise-wise to correct that when that navicular bone falls down that way, allowing the arch to collapse. Now, as the arch is collapsing, that's called foot pronation, and that causes the foot to roll in. Now, we talked about in another video how when both feet are doing that, it causes the weight bearing to go forward and then creates sway back and forward head tilt. But in this video, I want to show you from another perspective, looking at the body from the back or in the front, either way, and what it does to our body in that position. So let's take a look at this video and it'll illustrate this point. So this video is an excellent example, that little clip, of what happens as one foot pronates more, because they rarely pronate exactly the same. One usually will pronate more than the other. So as the foot pronates that way, it creates, in effect, a short leg syndrome. Even though the legs may be, if you actually could measure the leg, they may actually be the same length, but because the foot is pronating, it's allowing one leg to drop down more than the other, and then allowing the pelvis to tilt. And once the pelvis tilts, now we're out of center of gravity. And the brain says, no, 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 we can't do that. Just like the forward head tilt and the sway back were compensations for foot pronation. When the body feels that we're going sideways, it'll then curve the spine and bring the head back over the center of gravity, as was illustrated in the video. So the point here is that chronic pain is, in terms of neck and back pain, rib pain, mid-back pain, hip pain, a lot of these pains are caused by just poor alignment, poor biomechanics that have been created due to imbalance in the feet, and then the body attempting to compensate for that imbalance in the feet by changing the postural muscles, bringing the head back over center of gravity. And this is all done actually out of the intelligence of the body to try to keep us in an erect posture. And therefore, we're able to continue to function as a human being, which means that we have to be erect. But on the other hand, it's sacrificing the function of of certain areas of the body in terms of making them too tight or too loose, making the spinal joints move a different way in order to compensate, and that can create irritation and cause pain. The problem is that many times we unfortunately focus just on the pain, looking, oh, the person has tightness at C1, C2, or their L5 is rotated, or they can't move their thoracic spine, and we just do manipulation, or we do exercise, or maybe we give medication. If we're not a chiropractor, we prescribe meds for those areas. And all of those things are effective to relieve the symptoms that are being occurred. But if we're not looking at these underlying factors, what I call the etiological factors, then we're missing the boat. And the patient will continue to have these pains over and over again and will continue to need whatever care to treat it. And so this is a longer term approach at correcting these problems. So I hope that this helps us understand a little bit more about how chronic pain manifests as a result of biomechanical insufficiencies. Thank you.